In France, the government says people must learn to live with the coronavirus for some time to come. During a live televised address on Sunday evening, Prime Minister Edouard Philippe said many restrictions will remain even once confinement is eased. Without a vaccine or proven treatment, the country will focus on social distancing, mass testing and isolation to keep the outbreak in check. People may be required to wear masks in public, he said, and those who can should continue to work from home.
Notre vie, à partir du 11 mai,
Our life, from May the 11th onwards, will not be exactly as it was before confinement. Not immediately, and probably not for a long time.
Mais comme nous avons réussi le confinement
But since
ensemble,
we've achieved containment together, we will achieve deconfinement together.
comme nous avons appris à nous battre contre le
As we've learned to fight against the virus, we'll gradually learn to organise our collective lives with this virus by implementing new habits, by living daily lives that will be little different, but by regaining the freedom to which we're attached.
quotidien qui sera un peu différent, mais en retrouvant la liberté à laquelle nous sommes attachés.
Our international correspondent Annelise Borges is in Paris for us. Annelise, morning to you. It was quite a lengthy statement of the Prime Minister last night, but one thing sort of ran clear throughout, which was that there's still a long way to go for France as a country in handling this pandemic. What else did he have to say?
Good morning, Rosie. Well, indeed, Edouard Philippe spoke for over 2.5 hours and said the government's policy, the government's priority will remain the same during the lifting of the lockdown, which is protecting people's health, which is why Edouard Philippe said that May the 11th won't mark the return to our old days, to our old lives. Just like you heard in that clip, we'll have to learn how to live with the virus, especially in view of the fact that we won't get a vaccine most likely before summer next year. That's why Edouard Philippe said that social distancing rules will be crucial here in France in the next few months. And that is why certain companies will be advised to keep their employees working from home if and when possible. Schools are set to reopen gradually. There will be a different start day for different regions and different age groups, and that won't mark the return to the old type of schooling we saw here in France as well. The number of pupils per classroom will be reduced. Edouard Philippe also spoke about the importance of restarting the economy. He said that economic activity has been hit extremely hard here in France. The public health crisis is going to trigger an economic meltdown. It will be brutal, in the words of the Prime Minister, who also promised a full detailed plan of all activities to resume on May the 11th by the end of this month, a plan that will then be voted in Congress in the beginning of May.
He also had news about care homes and advice for families. What did he say about that?
After over a month locked in their rooms, Rosie, residents of French nursing homes will start being able to receive family visits in the next few days. Those visits, the way those visits will be carried out, will be left at the discretion of facilities. Families will probably not be able to touch their loved ones, their elderly residents of these facilities. But it's indeed very good news for these residents of these facilities that have been hit particularly hard by this epidemic. Lack of testing, of equipment, of overall resources have made it very difficult for caregivers to keep the virus away and for them to treat ill people for the disease.
Vous savez comment ça s'appelle? Mon bateau. Coronavirus.
Voilà. J'ai vu le médecin hier, il m'a dit vous ne l'avez pas. Bon, tant mieux.
At the age of 96, Nicole has seen a lot, which may explain the matter-of-fact attitude towards a crisis that has already claimed the lives of 90 of her co-residents.
Et ça vous fait peur?
At my age, we're not scared of dying. It's time. My grandma used to say you have to die of something.
In this nursing home in the outskirts of Paris, staff are doing everything in their power to prevent more deaths. But they're short on equipment, personnel, and disposable gowns.
We have to manage stock, so sometimes we have to wear bin bags. We have no choice, or to wash the gowns.
Caregivers asked us to wear the protective gear at their disposal to enter the facility, where dining rooms and hallways are now empty. Visits have been prohibited, and all residents are confined in their rooms in an attempt to prevent the spread of the virus. From March 1st until April the 14th, half of all COVID-19 deaths registered in France were registered in facilities like this one. But there's something administrators are even more concerned about. Strict confinement rules have had a significant psychological toll on its residents.
We have people here for whom the years or even months are counted. We don't have the right to steal the end of their lives, the love from their families, the affection they would be given.
Some 48 hours after the briefing, the government announced the resumption of family visits in nursing homes, if and when facilities permit. But administrators have yet to get the answers to other questions.
The way we counted the number of deaths in nursing homes, at first there were none, and then all of a sudden we had a spike in numbers. This shows that the government wanted to hide both the magnitude of the epidemic, but also the extent of the lack of resources for the dignified care for elderly people.
For some time now, French nursing homes have been requesting more funds, equipment, and personnel. The question now is, how long will they be able to keep protecting lives of the most vulnerable in society? Annelise Borges in Paris for Euronews.